When we hear the word amputation, our minds usually go straight to the surgery itself, the actual removal of a limb. But here's the thing. That one event, it's not the end of the story. It's actually just the starting line for this long, incredibly complex, and honestly pretty remarkable journey of healing and rebuilding.
So what does that journey really look like? From those first few moments right after surgery to living a full life with a prosthesis, it's a path that's defined by some incredible challenges, but also some seriously innovative solutions. All right, let's dive in and map out this road to recovery.
Okay, so right out of the gate, the first huge hurdle for nearly every single amputee is managing pain. But it's not as simple as just one kind of pain. Nope, it's more like a two-front battle against sensations that are coming from completely different places.
So on one hand, you've got what's called residual limb pain, or RLP. This is pain you feel directly in the stump, and it's often caused by things like nerve damage, or these painful little nerve endings called neuromas. Then, on the other hand, you have the much more mysterious phantom limb pain, PLP. This is the one you've probably heard about. Pain that feels like it's coming from the part of the limb that isn't even there anymore. It's a super complex signal that starts in the brain and the nervous system, and understanding both is absolutely key to fighting them.
For the longest time, the strategy was to treat all this pain after it showed up. But modern medicine is completely flipping the script. Now the approach is to get proactive and stop the pain before it can even get started, right there in the operating room.
And you can see exactly why this shift is happening. I mean, look at this quote. Post-amputation pain can be completely disabling, affecting up to a staggering 85% of people. This isn't just some minor side effect, it's a massive challenge that can totally derail someone's recovery.
Now this is where it gets really incredible. Just look at the difference here. With the traditional wait-and-see methods, the incidence of that residual limb pain is a massive 78%. But with these new preventative surgical techniques, it plummets to just 28%. I mean, that is a gigantic leap forward in patient care.
So, the big question is, how does this actually work? How can surgeons stop a nerve from becoming painful in the first place? Well, the core idea is actually pretty elegant. You give that severed nerve a new purpose, a new job to do, so it doesn't just end up forming a chaotic, painful bundle. One of the leading techniques is called targeted muscle reinnervation, or TMR. As you can see right here in this diagram, the surgeon takes the end of a major severed nerve and very carefully reroutes it, connecting it to a small motor nerve nearby. Suddenly, that nerve has a job again, to send signals to that muscle. It has a destination, which is what keeps it from forming a painful neuroma. Another really amazing technique is the regenerative peripheral nerve interface, or RPNI. For this one, the surgeon takes a tiny piece of muscle, a muscle graft, and uses it to literally wrap the end of the severed nerve. It creates this kind of biological cap. The nerve fibers can grow into that muscle graft, but they're contained, which effectively stops a neuroma before it can even think about forming.
Okay, so let's keep going. Once the surgery's over and that initial healing starts, the focus shifts to the physical preparation of the residual limb. This whole phase is all about shaping and conditioning the stump for what comes next.
The main goal here is pretty straightforward. You want to get rid of all that post-op swelling, or edema, and mold the stump into a firm, kind of conical shape. And this isn't just for looks. Having a well-shaped limb is absolutely essential if you want a comfortable and functional fit with a prosthesis down the road. One of the most common ways to do this is with elastic bandages, but they have to be applied in a really specific way. This here shows the figure 8 technique. You can see how the bandage is anchored and then wrapped in this crisscross pattern. The key is to apply more pressure at the very end of the limb and less pressure as you move up. This encourages all that fluid to move away from the stump, which reduces swelling and helps it mature. But bandaging isn't the only game in town. As this table shows, there are a whole range of choices, and each one has its own pros and cons. Soft bandages, they're cheap and easy to get, but they can slip or be put on wrong. Rigid plaster casts give you great protection and control swelling, but you can't see the wound. And then there's something called an IPOP, which is like a temporary prosthesis. It lets you walk early, but it doesn't work for every situation. The choice really comes down to the patient's specific needs. So while the limb is being shaped and cared for, the next part of the journey starts almost right away: physical therapy. And this isn't just about general exercise. It's about preventing very specific problems and building a totally new foundation for movement.
A huge unseen challenge at this stage is preventing something called contractures. This is when a joint near the amputation site gets super tight and basically gets stuck in a bent position. It can happen at any joint near the amputation, the knee, the hip, the elbow, you name it. And if a contracture develops, it can make it incredibly difficult, sometimes even impossible, to properly fit and use a prosthesis. So, how do you fight that? The answer is simple. You have to move. Patients start doing exercises often just a few days after surgery, and they're focused on two main things: keeping a full range of motion in those joints and strengthening the specific muscles that they're eventually going to use to control their prosthetic limb. It's all about building the muscular infrastructure for a whole new way of moving.
So after weeks, sometimes months of healing, shaping, and strengthening, the patient reaches this huge milestone: getting fitted for and learning to live with a prosthesis. But guess what? The journey of management and care doesn't stop there. This slide does a brilliant job of showing some of the crucial daily care that's involved. On the left, you see deep friction massage over the scar. This is so important because it keeps the skin from sticking to the bone underneath, which can be really painful. All of this consistent care is what prepares the limb to handle the incredible pressures of being inside a prosthetic socket day in and day out.
All right, so you can have a perfectly healthy limb and a well-fitting prosthesis, but one major challenge can still linger. Remember that other type of pain we mentioned way back at the beginning? What about that phantom limb pain?
Well, this is where things get really fascinating. There are these incredible, non-invasive therapies designed specifically to tackle this by retraining the brain. With mirror therapy, a mirror creates a visual illusion of the missing limb. The patient can then watch their missing limb move and unclench, which sends powerful feedback to the brain and helps remap those pain pathways. Another method, TDCS, uses a super weak electrical current on the scalp to gently change brain activity, basically helping to reorganize the brain's response to those phantom signals.
And the need for these kinds of brain-focused therapies is enormous. Get this, somewhere between 75 and 80% of all amputees experience phantom limb pain. That's a massive number. It's an incredibly common part of the experience, which makes developing these treatments absolutely vital.
So I think if there's one big thing to take away from all this, it's that recovery is anything but a one-size-fits-all checklist. It's a deeply personal, collaborative process. It's a true partnership between the patient, who brings the determination, and a whole dedicated team of surgeons, therapists, and prosthetists who bring the expertise.
It's honestly amazing when you step back and think about it. We've gone from just managing a wound to proactively rewiring the nervous system and literally retraining the brain. With these kinds of advancements, it really begs the question, what are the limits here? When we have nerves that can be rewired and limbs that can be rebuilt, what does the future of human recovery even look like?